Coronary revascularization choices for patients with diabetes is a very, very important vexing problem. About 5 years ago or 6 years ago, in 2012, Dr. Valentin Fuster, who led the one and only really diabetes study, revascularization choices with patients for patients with diabetes and multivessel disease, showed us that PCI was superior to CABG in terms of death, MI, CVA, hard clinical endpoints, hard major cardiovascular events. And that study, published in the New England Journal of Medicine some years back, was incredibly important, changed guidelines. We are now really referring these patients to CABG. But what's really important is a long-term follow-up of these patients after PCI, after CABG. And the Freedom follow-on study, which was presented here yesterday at AHA, looked at a 10-year follow-up, unprecedented 10-year follow-up of these patients. Only 50% of the patients, though, were available for follow-up because it was 50% of the sites who agreed to actually do this follow-up at a very, very low cost. And they only looked for vital status, mortality. And what they found, very consistent with the original Freedom study, is that overall the benefit for mortality benefit still remains in CABG. Now there are some, when you only have 50% of the patients at follow-up, you start thinking, well, there's some bias in there, but truly it's consistent. And I think we still have a lot to do for our diabetic patients. One of the other very important things that happened during that late-breaking trial session was another 10-year follow-up of patients undergoing stenting from the Munich group, the German Heart Center, presented the Yukon stent versus the old Cypher stent versus everolimus-eluting stent. These stents the focus was about how this biodegradable polymer with a sirolimus-eluting stent, is this a better stent technology than what we currently have available? But they had 10-year follow-up, which is unprecedented. And while the focus was on the stent platform, that yes, this biodegradable polymers, with biodegradable polymer sirolimus-eluting stent, the Yukon stent was as good probably as the Zion stent, I think the big focus for me was the event rates over a 10-year period after PCI in this patient population, which had a lot of diabetes and multivessel disease, and it continued to kind of play the same issue that these patients have a lot of background events. The mortality rate at 10 years was close to 40%, and that just is daunting. And I think we have to do better, and better is not doing more stents. Better is probably taking care of these patients' risk factors and getting them down the goal. And what this meeting has taught us, that aggressive lipid management, aggressive hypertension management, and aggressive risk factor modifications could have very, very important impacts. And I think that was just a telling sign that we must do more than mechanical revascularization. There's no question that it's extremely effective, but we also have to deal with all of the residual risk factors in our patients.